So today we're going to talk about head lice. We're going to talk about what causes head lice, the symptoms, how to diagnose it, and how to treat it. That's the most important. So let's talk about, first of all, what is head lice? Head lice is an infestation of the scalp caused by a louse known as pediculosis capitis. This type of louse is transmitted by direct close personal contact with someone who has the infestation or by sharing personal items, things like brushes, hats, or pillowcases. So sleepovers, beware. Children are more commonly affected, but people of any age can get lice. Let's talk about the symptoms. Usually lice presents with this intense itching on the scalp, and this is due to a hypersensitivity reaction to the louse saliva. Louse actually feed on your blood by biting into the scalp and drinking it. And so when they inject their saliva, your immune system comes into contact with that and can develop an allergy. If you've never had lice before, the symptoms usually start about 4 to 6 weeks after acquiring the infestation. You can notice some scaling or eczema type changes, especially along the back of the head or behind the ears. A lot of people might actually notice swollen lymph nodes, particularly in the head and neck area. So along the chin area here and at the back of the scalp. And because people tend to scratch because it's itchy, that can lead to a breakdown in the skin barrier and predispose you to infections caused by Staph aureus or strep type bacteria. Now let's talk about how to diagnose lice. Diagnosis is confirmed by seeing the actual lice crawling around in the hair or seeing nits or eggs attached to the hair shaft. If you see nits or eggs on the hair shaft, they're usually within 1 centimeter of the scalp to be viable or still alive. If you see little white things in the scalp attached to the hair shaft, that doesn't necessarily mean that you have lice. There's lots of other things that can cause that. Examples are dandruff, something called hair casts, or just scaling from the scalp if someone has eczema or psoriasis. Nits in particular tend to be cemented well on the hair shaft and they're difficult to try to remove. Whereas scale, if you try to grab it with your fingers and pull, it's usually very loosely adherent and comes off easily. Now let's talk about how to treat head lice. Once you've had the diagnosis of lice, I recommend definitely going to a doctor to make sure that you get the right diagnosis. Usually it's treated with something called Nix or permethrin 1% cream rinse. This is safe for kids over the age of 2 months. The way to use it is first you have to shampoo the hair, and this time don't use conditioner. So you get it nice and wet, you lather in the shampoo, you rinse it off. And then on the damp hair, you're going to apply this medicated cream rinse to the entire scalp. Make sure you work it well into the roots of the scalp and work it into a nice lather. Then you let that sit on the scalp for about 10 minutes and then it's rinsed off. Usually you repeat the treatment again in about 10 days. And then it's important to also wet comb the hair with a knit comb every 2 to 3 days until the nits are removed. So a knit comb is a special comb with these tiny little prongs that helps to pull out the little eggs as well as any adult lice that have been killed off. The medication itself won't remove the eggs from the hair. Now, it's important to know that some lice have actually developed resistance to permethrin, meaning that they have these mechanisms that allows them to survive the treatment. And so there's other treatment options, for example, dimethicone, or in the States, they have something called topical ivermectin or abimidopir or spinosad, which are all very effective. In some cases, we also have to use oral ivermectin or a pill for refractory cases. Now, there's a lot of talk online and in different resources about using things like mayonnaise, olive oil, and essential oils. We really don't have enough evidence to say that these work effectively to kill off lice, and so I recommend sticking with the more traditional prescription treatments. Now, as I mentioned earlier, the treatments themselves don't actually remove the nits, so you have to make sure that you comb those nits out with a knit comb. If you notice there's still nits or those little eggs on the hair shafts, but they're more than 1 centimeter away from the scalp, this does not mean that the treatment didn't work. You only need to repeat the treatment after your 2 courses if the nits or the eggs are still within 1 centimeter of the scalp. Now, the other part of treatment is making sure you get rid of any lice eggs or adult lice that could be on your belongings. So you want to make sure you launder all your linens, clothing, hats, pillowcases, things that you used or your child used in 2 days before treatment. And you want to make sure you wash those things in hot water and dry it in the dryer on high heat. If you have items that can't be washed, like stuffed animals or brushes, you can put those in a sealed plastic bag and leave them untouched for 2 weeks. Now, if you're an adult with head lice, it's also important to treat any bed mates prophylactically. So anyone that you're sleeping or sharing a bed with, you should have them treat themselves as well. Any household members should be examined by a healthcare professional and treated if they show signs of the infestation. One important thing is, because it's back to school, it's actually not recommended that kids miss school due to lice. It's important, obviously, that they avoid direct head-to-head contact with other kids and that they avoid sharing items like hats or brushes until they've been adequately treated. But they do not need to stay home, and that statement has actually been released by the American Pediatric Society. So that's it for this video. Talked about lice, the symptoms of lice, what causes it, how to diagnose it, and how to treat it. Make sure you do see a doctor to get the diagnosis before diving into treating it yourself at home. If you like this video, make sure you give it a thumbs up and leave a comment in the section down below if you have any questions. I'd love to hear from you. Make sure you subscribe to my channel and stay tuned for any upcoming videos like this one. Thanks for watching, guys, and we'll see you in the next one.